Hey everyone, and welcome to today's Explainer. I'll be your host today, and we're going to take a really fascinating look at something almost all of us worry about at some point: preserving our joints. We are taking the very latest medical insights and nutritional science from top experts, and we're going to break it all down for you right here. You know that feeling, right? You're walking down the stairs, you feel that sudden stiffness, maybe hear a little click in the knee, and instantly your brain goes, well, that's it. Knee replacement surgery is definitely in my future. But actually, as we'll see today by looking at the data, the answer to that is a resounding no. Your knees are absolutely not destined for the operating table. So here's our roadmap for today. We'll start by uncovering the actual root of knee pain. Then we'll master the kinetic chain, look at smarter shoe and stair habits, check out some natural foods to strengthen those joints, rethink total knee replacement entirely, and finally, look at an amazing medical breakthrough for preserving your original knee. All right, kicking things off with part 1, the root of knee pain, and understanding joint wear and tear, because you really can't fix a problem until you understand its true root cause. So around age 35 or 40, natural wear and tear just kind of begins. Tissue elasticity drops. For women, hormonal changes right around menopause drastically lower estrogen, which in turn lowers bone density and calcium levels. But here is the real kicker, the absolute most critical point. Our modern, largely inactive lifestyle forces our joints to carry loads they simply were not designed for. If your muscles are weak, they just stop absorbing impact. And guess where that physical burden goes? Yep, straight onto your bones and cartilage. Which brings us to part 2, mastering the kinetic chain. Because, surprisingly, knee health really isn't just about the knee at all. It's a full body system. We absolutely have to talk about the kinetic chain. Think of your core, your pelvic muscles, your glutes, and your legs as one big interconnected network. Basically, they're your body's built-in shock absorbers. Now, if your core and pelvic muscles are weak, your knee joint ends up rotating improperly. Experts call this eccentric rotation. It's like a car completely out of alignment. It loads all this intense pressure onto the vulnerable inner side of your knee, gradually wearing away the cartilage and sparking arthritis. The major takeaway here, to save your knees, you actually need to strengthen your core and pelvis. And speaking of mechanical load, there's a magical number you need to remember, and that number is 5. Our sources highlight that losing just 5 kilograms of body weight can reduce your early joint pain by a whopping 50%. I mean, that's huge. Extra weight literally changes your center of gravity and tightens up your hamstring muscles, which can put up to 3 times more pressure right on the inside of your knee. Drop those 5 kilos and you instantly take a massive, destructive burden right off that kinetic chain. Moving on to part 3, better shoes and stairs. These are actionable daily biomechanics you can adjust right now to save your cartilage. Now, you might assume that walking barefoot or wearing completely flat shoes is the most natural, healthy thing you can do. Well, actually, scratch that. Both high heels and entirely flat shoes mess with your center of gravity. Completely flat shoes literally force you to work harder just to walk at a brisk pace. For ideal biomechanical support to protect your knees, you really want to aim for a comfortable 1-inch heel lift in your everyday shoes. And what about stairs? We go up and down them all the time without a second thought. Here's a tip. Stop leading with your knees. When you're climbing stairs, consciously try to generate that upward power from your pelvis and your core instead. Oh, and whether you're taking the stairs or doing weighted squats at the gym, absolutely do not let your knees collapse inward. If they're caving in, you're literally just grinding down your own cartilage. Here's a really fantastic, immediate trick from the experts. If you have patellar tendonitis, you know that sharp, annoying pain right on the very front of your kneecap, you can use those same stairs to heal it. Just stand with the balls of your feet on the edge of a step and let your heels drop down. That stretches your calves, which instantly relieves the tension pulling on the front of your knee. It's just a super simple biomechanical fix. All right, on to part 4, foods to strengthen joints. Let's look at natural kitchen ingredients for repair. Because let's be real, biomechanics are only half the battle here. Your diet is basically your body's best internal doctor. Take a look at these everyday kitchen ingredients. Sesame seeds, also known as UNTILL, are these tiny little powerhouses packed with calcium and healthy fats that physically lubricate your joints. Then you have Ragi, a fantastic millet that actively halts bone density loss and helps repair cartilage. Turmeric is your go-to for cooling down internal swelling, and Moringa, or drumsticks, are absolutely loaded with vitamin C, which your body specifically needs to synthesize the collagen that cushions your joints. They all work together beautifully. I do want to zero in on turmeric for a second because it really is a phenomenal natural painkiller. The curcumin inside it works wonders for drastically reducing swelling. But there's a pretty big catch. Your body actually has a really hard time absorbing turmeric on its own. To make it work, you have to pair it with black pepper. Adding black pepper literally unlocks the curcumin and makes it highly effective. Just be sure to have it with a meal or some warm milk. Definitely don't take it on an empty stomach. Let's jump to part 5, rethinking total knee replacement. Is there a better way? If you feel like you missed the prevention train and you're dealing with severe pain, you might be terrified that surgery is your only remaining option. But based on our sources, we really need to reevaluate the traditional total knee replacement, or TKR. It's intensely invasive. We're talking about a massive 6-inch incision, and surgeons literally have to slice through your quadriceps, the absolute strongest muscles you have. And honestly, the worst part? It completely sacrifices your ACL, the key ligament that stabilizes your entire knee. Because of this, traditional surgery deeply compromises your kinetic chain for good. After a TKR, you're usually told you'll permanently lose the ability to squat or sit cross-legged on the floor. One of the medical experts we looked at actually shared a really powerful perspective. They said, "I call total knee replacement a cruel surgery. We are replacing the things which are normal." And if you think about it, that makes total sense. Arthritis usually starts by damaging only about 20 to 30% of the knee's cartilage, typically just on the inner side. Completely gutting a mostly healthy knee places a severe and frankly unnecessary physical and mental burden on a patient, which perfectly sets up part 6, preserving your original knee, and the medical breakthrough of MRP. Let's look at an amazing alternative. Enter the meniscus replacement procedure, or MRP. Now, unlike a TKR that sacrifices your ACL and stops you from squatting, MRP is beautifully minimally invasive. The surgeon uses a tiny 2.5-inch side incision. You get to keep your ACL entirely, you keep your major muscles, and your healthy bone stays totally intact. It's basically like having a microscopic mechanic go in and just swap out the damaged meniscus cushion. We can literally make your knee feel 10 years younger without taking away your natural joint. And you can really see the massive difference when you look at the recovery timelines, because meniscus replacement avoids slicing up your major muscles, bleeding is minimal. In just 2 to 3 weeks, MRP patients are often seeing their full range of movement completely restored. Contrast that with traditional TKR patients who are still stuck going through months of really agonizing, sleep-depriving physical therapy. You get to completely bypass that entire nightmare. This elegant MRP procedure goes way beyond just relieving pain. It completely restores your active life. The new meniscus acts kind of like a smooth ball bearing, moving perfectly naturally with your joint. And it's incredibly durable, lasting 18 to 20 years, which completely matches the lifespan of a full knee replacement. But the absolute best part? Because your ACL is still there, doing its job, you retain the liberated quality of life you enjoyed in your 30s. You can still run, you can do yoga, and yep, you can easily sit cross-legged right on the floor. And that brings us to our final thought. The science is incredibly clear here. Painful knee deterioration doesn't have to be your destiny. By strengthening your kinetic chain, shedding just 5 kilos of weight, nourishing those joints with things like Ragi and turmeric, and exploring advanced joint-preserving options like MRP, the choice of your health span is truly in your own hands. So ask yourself this: will you simply add years to your life, or will you add a vibrant, active life to your years? Thanks so much for learning with us today on this explainer. Keep exploring, stay curious, and take care of those joints.